Welcome to PSM with Ranjit. Today we will be talking about a very important topic in community medicine, that's tuberculosis. So let's go ahead. So tuberculosis is caused by the microorganism Mycobacterium tuberculosis, and it primarily affects the lungs. Whenever it affects the lungs, we call it the pulmonary tuberculosis. Whenever it affects any other organ other than the lungs, such as the intestine, the meninges, the bones and joints, lymph glands, or skin, we call it extrapulmonary tuberculosis. Next, we come to the problem statement. On a global scale, we will see around, any guesses? Yeah, 1/3 of the global population is infected asymptomatically with TB, of whom almost 5 to 10% will develop clinical disease in their lifetime. The annual risk of TB infection in high burden countries is estimated to be almost 0.5 to 2%. Patients with infectious TB can infect almost 10 to 15 persons per year. Newly diagnosed MDR-TB is around 3 to 4%. MDR-TB in previously treated TB is around 18 to 21%. TB load in children is around 10%. Now this sounds all very difficult, and it sounds very, how will I remember all these numbers? So what we're going to do is, before we see all these numbers, first I want you to take a screenshot of this particular image. Okay, now the next screenshot I want you to take is, I'll put numbers here, different numbers, and you just have to take a screenshot once I finish writing the numbers. One is 10 to 15, the other one is 5 to 10, and the other one is 1/3, and the other one is 10. Now take a screenshot. So the next option is going to be, let's see where we can fill all this. So the only numbers are almost like around the 10 that I want you to remember, and something around 1/3. Okay, these are the two numbers. So easy, we can say that almost 1/3 of the global population is infected asymptomatically, of whom 5 to 10% will develop TB in their TB clinical disease in their lifetime. Annual risk, if you can remember, well and good. If you can't, no problem. Now, patients with infectious TB, this is a very important number, 10 to 15. So if you can see, we started with 1/3, then we started with 5 to 10, then get to the next number, 10 to 15. Newly diagnosed MDR-TB is around 3 to 4%. This is also important because MDR-TB is on the rise, and especially in previously treated TB, it's around 18 to 21%. That means our TB patients are not getting treated properly, and that might be the reason why MDR-TB is increasing. The compliance is poor, and that could be the reason that 18 to 21% rise is there among previously treated TB. Now again, magic number 10. So TB load in children is around 10%. So that's also a huge number. Take a screenshot. Now what I want you to do is, whenever you're revising my videos or something, you just have to take these three. I don't want you to go to my video, read it again. Take these 3 pages, where one without the blank, one with all the numbers, one with all the answers. So when you go to your gallery, anywhere, picture or anything, what you have to do is very simple. First, see the first picture and try to guess what are the numbers there. That is the only way to keep on remembering how to look at numbers. Now, epidemiology, you cannot remember every number of every disease. That is ridiculous. Now, if you ask a community medicine person also, professor also, he will not be able to say each and every number because it keeps changing. Maybe today this number might be what is written in your park textbook, but tomorrow it could increase or decrease. So for now, for your exams, please understand, just remember these numbers, at least 1 of 2. So coming to the epidemiology in India, TB, of course, it is the highest TB burden country in the world, and that is why you would feel that the thumbprint of this video, the national disease of our country, is TB, because we have the highest burden compared to any other country in the world. Now, again, I want you to take a screenshot of this. After that, I'm going to write some numbers and we'll just fill it up later. The first number is 1/4. Then I'll put one more number, 188. Another number is 36. Another, let's reverse that number, 63. And then finally 20. So again, you're going to put this, take a screenshot of this, and let's put the answers for this. It accounts for 1/4 of the estimated global burden in the world. TB burden in India estimates, I'll give you some bit. The total TB incidence in 2020 was 188 per 1 lakh. The TB mortality is almost 36 per 1 lakh. And the TB treatment coverage at present in 2020 is 263, and TB case fatality rate is basically 36 divided by 188, and that accounts to almost 20%. So again, I want you to take a screenshot. So you get 3 images, one without the answer, 2 with the numbers lying around, and 3 with the answer. So quickly you will be able to revise it. Next, now what is the social impact of TB? TB affects usually the adolescent and young adults, and that is one of the most productive periods of the population, of the Indian population. Why do we want somebody at the age of 15 to 30 die due to TB or suffer due to TB? And that has a lot of repercussions on the economic and social burden. Almost 2/3 of the cases are male and they are in their productive period. Another impact is TB kills more women in the reproductive age group than all causes of maternal mortality combined. TB is the disease of the poor. Poor living conditions, malnutrition, shanty housing, overcrowding are all risk factors for the spread of the disease. 2. When you become immunocompromised, you are always at the risk of developing clinical disease of TB, and hence HIV and type 2 diabetes mellitus always increases the susceptibility to the disease. And that is why we always test for HIV and type 2 diabetes anytime we get a TB positive patient. So too many numbers, and now let's take a break. Let's take a pause for a second or two and think about all the good things that have happened in your life. Just pause, close your eyes. I know there might be an exam tomorrow, or maybe a week later, or maybe a month later, and that's why you're watching this video. So what? Let's just close our eyes for maybe 10-20 seconds and just think about how life is, how good life is, how beautiful it is, and what makes a day so good. It could be anything, it could be just a smile from your friend. Just let's imagine that beautiful moment that we had today and feel positive about it. Moreover, be grateful for just all the things that have happened today around you, and that might not happen every day. And being grateful is always a great thing in life. You tend to appreciate everything around you once you start doing that. So, yeah, let's come back. Next, we have epidemiological indices, which are used to measure the burden of TB in any country. So, first we have the incidence. Incidence is, as you all know, is the number of new and recurrent episodes of TB. Recurrent can be in any form in a given year. Understand in incidence, know when you follow up a certain population, none of the people of those populations should have that particular disease. In this case, it is TB. Prevalence is the number of TB cases, all forms, in a given point in time. It can be new or old cases. Mortality, as you know, is the number of deaths caused by TB in HIV negative people. So, whenever a person dies with TB in an HIV positive, it's considered as an HIV mortality rather than a TB mortality. That is also important to understand. Case fatality rate is basically what the number of deaths due to TB among people who have the active disease. So the numerator will be the deaths due to TB and the denominator will be the people who have TB. Next, we have case notification rate. That is basically all your new and recurrent episodes of TB which is notified to WHO for a given year. Next, we have case detection rate, which is the number of notified cases in a year divided by the estimated incidence of such cases in the same year. So we get an idea how much was actually could have been the number of cases, and out of that, how many have actually been reported, and that is what is case detection rate. Next, we have the prevalence of drug resistant case, same as, but the only difference is that we are looking at drug resistant TB. That is, at a particular point, new and old patients with drug resistant TB is what you call prevalence of drug resistant cases. Next, we have prevalence of the infection. These people may not have the will not be having the clinical disease, but they have a positive reaction to the standard tuberculin test. That is usually the tuberculin skin test. Okay, or we nowadays we use IGRA, that is interferon gamma release assay. Then we have the incidence of infection, that is the annual infection rate, that is what population will be newly affected with mycobacterium tuberculosis among the non-infected. I said in incidence, the people should not have the disease. So out of that, how many will be affected with pulmonary TB in a survey during the course of 1 year? That is basically your annual infection rate. It is also known as the tuberculin conversion index because it is one of the best indicators for evaluating the TB problem and its strength, because we will be able to know, okay, these many number of people will be having the disease. If at all there is a group of people who do not have TB in the course of 1 year, it basically gives you the attacking force in the community. So thank you for watching this video. Hope you like this very short segment. We'll have this series on TB. We'll continue this discussion, and please, if you like this video, like, share and subscribe this channel. Please tell your friends. There's a beautiful channel called PSM with Ranjit, trying to make community medicine as simple as possible. All the best. Take care.